Good morning. It's just great to meet people that I've been corresponding with and people who are doing great work across BC and beyond. Thanks for the invitation to speak with you today. And I got to tell you, not only are these talks that I've heard very informative, they're spectacularly compelling and make the case so strongly. And I have to say that in addition to being engaged professionally, I'm thoroughly enjoying this morning. I hope it continues. So I think that my slides are coming up. And all I'm going to do is spend a few minutes with you just telling you about the new kid on the block in FLS in Canada, which is the Brookfield Chair in Fracture Prevention.
I think you just hit the wrong button. Make sure you hit the arrows.
Okay, thank you. So the Brookfield Chair was established right at the beginning of the pandemic, 2.5 years ago, which of course would have been a formula for failure, but I don't think it's working out that way. And Brookfield Partners Foundation came forward with a gift of $3 million. And I asked to establish a chair at the University of Toronto, which was university accepted that. And so this is, to my knowledge, the first academic chair of its type for fracture prevention specifically. Now, the purpose, the mission of the Brookfield Chair was, in addition to growing, supporting, strengthening our research team on this subject at St. Mike's in FLS, our principal goal is to advance fracture liaison services in Canada, advance the spread of FLS in Canada, in close partnership with Process Canada. And I don't have to explain why FLS is the only method proven to prevent a fracture in fragility fracture patients. That case has been made so well, and I thoroughly enjoyed that presentation and also the cost effectiveness. And be aware that Canada has been a pioneer in this subject, and we should still be leaders in fracture liaison services. We have some of the best health records, we have some of the best health research and health teams in the world. Many Canadian academics and clinicians have published a great deal of data on the delivery of fracture prevention services in Canada. And these are just 3 examples of the many publications that have come out of my research team at St. Mike's. Here's one of a more recent one about the cost utility of fracture liaison services, how it saves money and saves health system capacity, which is also important. There's another one of our studies there about how osteoporosis care is improved by FLS systems. And another thing that's emerging is work to show that FLS includes equity in care. Equity in this case for males were often ignored. And we're talking now with Yukon about Northern health equity and First Nations health equity. There are many dimensions to that. So I don't really have to dwell on this because Dan has done it so well. So we were pioneers. The thing makes a case for itself. Shouldn't we be way out in front? Well, you know, depending on how you interpret the very good data available at the FLS Hub, only 13 to 17% of sites in Canada are covered. And as you see, in the first 5 or 6 years, our program at St. Mike's was the only one in the country. And then with the Ontario osteoporosis strategy, there was a big bump up and things grew modestly. I wouldn't say rapidly. They grew modestly across the country. But unfortunately, since about 2015, the expansion of FLS services across the country has not really continued. And this is a source of great concern and dissatisfaction for all of us who are engaged in fracture prevention in the country. And all of us have been scratching our heads about what to do. So when the $3 million came in the door, I thought, let's do something different. Establish an academic chair and just try to create a different kind of a noise around the FLS and see what we can do. So we heard a very good discussion about the patient perspective, why FLS is hard to grow. But then there's the health system issue. We have 13 jurisdictions for health management in this country. And that means a separate conversation and a separate development process in all 13. So that's a real obstacle. And it's not really that public payers, the departments and ministries of health are reluctant to pay for FLS. It's just that they have many obstacles to establishing FLS. We've already heard something about that. So what I thought, after numerous discussions with Pamita Jiwa at Osteoporosis Canada, we decided that the Brookfield chair should try to publicize FLS in a slightly different way than has already been done very actively by OC. And we wanted to be a visible partner, like I say, a new kid on the block, boosting FLS in the country. So this is our core strategy for the Brookfield chair. We went to find the best prepared teams, just like many teams in the room, and seed fund them for 2 years of operation. And then with rigorous data collection and evidence, prove at the end of the 2-year funding program that the program is effective and necessary. And engage and partner with provincial and territorial governments right from the beginning. Even if they don't provide funding right from the beginning, it's better if they do. But even if they don't, engage in order to assure continuity, long-term continuity of the FLS program. So how did we find the right sites? Now, Diane Theriault identified sites that she had worked with for years, who were ready to go, enthused and capable, but unfunded. We found those. Sonia identified fertile sites in BC, like Chilliwack. And I met with Yukon and Saskatoon, 2 other contacts, and we're talking to other sites also engaged now. Now, in terms of publicizing FLS, this is a little bit lighthearted. We decided that OC had already produced enough really great materials that were serious and academic. We thought we'd take a slightly different tack and add to it some things that were lighthearted, maybe modern, kind of ad agency type copy and art. So here's an example. Here's another example of the work we're doing. As again, it's lighthearted and it has a different feel. It's not serious, it's not academic. We've done lots of that. There's another picture from our materials. And so I'm going to recommend that when you have a moment, just go to breakfree.ca, which is our website, to see some of our materials. And also we're working closely with Tracy Napoli under Famita at OC, who are publicizing the Brookfield chair in their newsletters, in their announcements on the website, and through their quite advanced social media links. And here's an example. When Chilliwack and Charlottetown were funded by the chair and started up at the end of last year, in January this appeared, an announcement about the two new programs, the first 2 new programs that were like tied to the first. So about Chilliwack, just very briefly, Dr. Chen, the medical director at Chilliwack General Hospital, and some of his team, some of the Chilliwack team, I should say, is here. In Charlottetown, Martha Carmichael, medical director Scott Weatherspoon, the orthopedic surgeon, have a program covering all of the PEI. Sonia has been able to use some excess funding, extra funding from Brookfield to expand her position from points to full-time FTE, to expand the program to inpatient and outpatient, and set up a training option for future coordinators in BC. And Sonia is the shining light for FLS on the West Coast, and we were happy to provide some excess funding to help her reach more of her goals. And here are three of our new coordinators from PDI, from Peace Arch. Well, she's not a new coordinator, it's just that her salary has been, her position has been expanded, and in Chilliwack, of course, here. Jody Reese is here from Saskatoon, who's already done tremendous FLS work in Saskatoon and looking to advance the program and make it sustainable over time. We're very privileged to have with us today Scott Westberg. Kevin McLeod is scheduled to appear, be delayed, and Alex Taylor, who's a senior policy advisor in the Department of Health and Social Services in Yukon, is here representing Minister Michael Hale. We've already had marvelous discussions. I hope this is not premature, but Fredericton, New Brunswick is about to announce their program. They've been working on it for years with Diane and her group, but the Brookfield chair is going to help them get over the hump and get funded to get started. And we're talking to Daniel Stackew in Yellowknife. Now, I want to make the point that we have reached our goal of partnering with governments. The PEI Health Break-Free Fracture Liaison Service is co-funded 50%. The New Brunswick program will be funded 50% by the Ministry of Health for the first 2 years and 100% in the agreement for years 3 and 4. And we're having ongoing positive discussions with our Whitehorse team and the Yukon Ministry. So our business model of public co-funding from ab initio seems to be working. So again, to sum up, the key goal of the Brookfield chair is to create new FLS sites across Canada by working with teams who are ready to go but don't have funding. We provide seed funding. We're trying to increase the visibility of FLS to make some buzz happen. We're trying to potentiate the accomplishments of Osteoporosis Canada in this domain that have already been accomplished. We're just trying to give it a little boost to cover more of the country. And our ultimate goal is to provide enough momentum so that FLS reaches a tipping point in this country where it becomes an integral part of the health services across the country. So that's the Brookfield chair. Thank you very much.